So James asks about an adult son with chronic asthma. So one of the first research reports that I read about asthma was actually in an early book that I had co-authored about magnetic field therapy in Eastern Europe. And what the Russians and Eastern Europeans discovered is that they treated the spine, right in the back, the upper part of the spine. So here's the head, and here's the neck. So here's the upper back. So you want to treat in the upper back. That's where the spinal nerve traffic goes in that controls the opening and closing of the airways, the sympathetic parasympathetic nervous system. So they found that they could open up the airways by doing magnetic therapy to the back. But that's old science. The current thinking about asthma is that it's not only a nervous system issue, parasympathetic sympathetic imbalance problem causing the airways to be constricted, because that's a reaction. So that's a parasympathetic reaction or sympathetic reaction to closing the airways. It's actually parasympathetic. So what happens is that that's caused by inflammation. That's caused by irritable airways. So the modern treatment is to reduce inflammation. That's why the medications that are being used today, the inhalers, are primarily combined with a steroid and a bronchodilator, right? That does take care of the problem chronically, and it keeps the airways from constricting, so it opens them up. Magnetic field therapy can be used to the chest in the front to help to deal with the inflammation in those upper airways, but it can also be used in the back. And that would get the nervous system involved in managing the airway opening. So I use a combination approach. To go back to the very beginning of the presentation, here is where the intensity makes a difference. You have to reach that magnetic field deep into the body. You have to decrease the inflammation. You need a minimum of 15 Gauss at the target tissue. So from the skin of the chest, you have to go in probably about 4 inches, 5 inches into the bronchi. And not only do you have to go into the bronchi, you have the stems of the bronchi. So here's the bronchus, and that breaks off into other bronchioles and other divisions of those bronchi. So you have to go down fairly deep into the lung to decrease the inflammation. I have a patient who came to me as a holistic doctor who had been taken care of by an academic pulmonary doctor. He has horrible asthma. He had at least 4 admissions a year to the hospital, admitted into the hospital for 4 or 5 days to manage his asthma. Being managed by an academic pulmonary doctor, but nobody was managing him holistically. So as a holistic physician, I got him on a bunch of supplements, changed his nutrition, we talked about attitude, we looked at his medications, and then we started magnetic field therapy. When we did that combination of all of those things, all of a sudden he has had 0 admissions, 0. He's on 1 ER visit in the last 4 years. That's the power of this kind of therapy. So if you want to get off medication, I don't advise you to get off medication. I don't take away your crutches if I know you can't walk yet. That's silly, it's stupid, it's bad medicine. So if you start doing magnetic field therapy and you're doing your conventional therapies, and then you make the nutritional changes, you add the supplements, you increase anti-inflammatory activity in the body, all of that works over the next 2 to 3 months. You can begin to cut back on the medication. If all of a sudden you don't need your bronchodilators as often, you don't have to rescue as often, then you could look at cutting back on the inflammatories, anti-inflammatory medications. But you need to work with your doctor. Hopefully you have a doctor who will work with you. If you don't, you're going to have to find one who will. And holistic physicians generally will be ones that you should be able to work with, combining magnetic field therapy along with conventional medicine. So I do use conventional medicines. I'm not opposed to using conventional medicine. It doesn't make any sense not to if that tool is available, but you got to use it appropriately. So in other words, we're in medicine today, in our society today, if your only tool is a hammer, you treat every problem as a nail. So every conventional doctor doesn't know anything about holistic medicine. They don't care about nutrition, mostly. They don't care about your attitude. They don't care about your emotions. All they want to do is give you the medications and get you out of the office. Now, I'm not disparaging doctors. There are a lot of very good doctors who are very open-minded, conventional doctors. But most of the time, you're going to have to find a holistic physician who's going to be more likely to be open to adding things together to produce a more comprehensive approach. Okay, and I've discussed this on other webinar Q&As as well, that you need to combine approaches to get the best results. It takes a village to deal with the problem. And most physicians, because they only rely on the medication, do not complete the treatment. They don't provide a comprehensive and a complete treatment. A good example of that I mentioned in a previous session is that if you have an infection and somebody gives you something for your infection, all they're doing is killing the bugs. They're not helping the infection. The body, they rely on the body taking care of itself. If you have surgery, what does the doctor do to help you to heal yourself? Nothing. They give you painkillers and have you come back a week or 2 weeks to see how the wound is doing. And you cross your fingers that you're healing. That's leaving things to chance. Holistic medicine doesn't have to leave things to chance. We know that we have a lot of other tools that we can use to provide a more complete healing program. If you're fortunate enough to have a holistic physician and you get into trouble and you need an appendectomy, then you're going to be able to see your holistic physician along with your surgeon to get a much better result and much faster, more complete healing with the less likelihood of complications and problems down the road.